Joining us now, Dr. David Scheiner of Chicago. He's a member of Physicians for a National Health Program, which supports a single-payer national health insurance program. He was Barack Obama's personal physician in Chicago for more than 2 decades. Also joining us, Dr. Dean Ornish. He's the founder and president of Preventive Medicine Research Institute. He's the medical editor at HuffingtonPost.com. And Congressman Ron Paul, Republican of Texas, former Republican presidential candidate. He himself is an MD, was a flight surgeon in the U.S. Air Force, later an OB/GYN in civilian practice. Gentlemen, thanks to all of you for coming in. Let me play for you what President Obama said today about a so-called single-payer system.
I'm not promoting a single-payer plan. I am promoting a plan that will assure that every single person is able to get health insurance at an affordable price, and that if they have health insurance, they are getting a good deal from the insurance companies. That's what I'm fighting for.
Dr. Scheiner, you're disappointed in your old friend, your patient, President Obama, because you want a single-payer system along the lines of what's the system in Britain or in Canada. Is that right?
Yes. You know, my legitimacy is not just that I took care of President Obama. I have a huge practice. I see between 4,000 and 5,000 patient visits a year. 80% of my patients are in single payer. The federal government has never, in the 40 years I've dealt with Medicare, never interfered with the care of my patients. This constant myth that government will get between the patient and the doctor, it is an absolute myth. The insurance companies are constantly in our way, constantly interfering. I lost a patient yesterday who had to leave me because she didn't have the right kind of insurance. The cost of private health insurance administration is $400 billion a year. If we had a single payer, that would be eliminated. The 50 million or 48 million could be covered just by that saving alone. Continuing private health insurance is crazy. The private health insurance companies have not shown us they can be trusted. Why do we keep coming back and asking them to be that we can trust them? And the pharmaceutical companies, why aren't we buying in bulk and negotiating the prices of the drugs? The rest of the world looks upon us with disdain. We're 37th in the world in health statistics. Even Slovenia is ahead of us. And as Carville said, we pay twice as much as our nearest competitor.
All right.
This is insane.
Let's ask Congressman Paul to respond. I suspect you disagree.
Yes, I do. We have a one-payer system with Medicare, and it's broke. And so that's part of the problem we have today. Everybody agrees we have reform. But where I find we're missing the boat is the definition of what we're doing. For some reason, I think it's the fact that 35 years ago we introduced the notion of managed care based on the fact that people thought they have a right to medical care. I don't accept that, because if you do, that means the majority can vote to demand anything they want from the minority, and in a free society you're supposed to protect the minority, not the majority. But then also this idea of insurance, I keep using this issue of insurance, it doesn't even conform to the definition of insurance. Insurance is something that measures risk, and the medical insurance does not measure risk. They want paid insurance. They want paid services. I mean, what if we tried to pass out food in this manner? It absolutely wouldn't work. But the real key to this is not a whole lot of people are totally upset with the medical care system. What they're upset with is the cost, but nobody's really talking about why the costs are high. You have inflation. You need tort reform. Tort is one thing. We don't have competition. We're not allowed to sell these insurance policies across state lines. So there's a tremendous amount. But let me tell you, you're never going to solve the problem of high cost of medical care if you don't solve the problem of inflation, and that's coming down the road.
Let me let
you have to have competition.
Dr. Ornish weigh in as well. The president's having a tough enough time even getting what's called a public option, a government-run health insurance agency to compete with the private health insurance companies, let alone a single-payer system. Realistically, what do you hope for, Dr. Ornish? Because I know you've done a lot of work in preventive medicine.
Well, thank you for the chance to be here. I agree. I have great respect for President Obama, and I agree that we need universal coverage. but I'm deeply suspicious of single payer. It sounds great in theory, but I think the founding fathers had it right. When you have too much power concentrated in one place, whether it's what happened with the Bush administration with the executive branch taking on too much power, or some of the large corporations who misuse it, or what happens with Medicare. It took us 14 years with Medicare just to get them to cover intensive lifestyle interventions. I think we're asking the wrong it's a false choice here. The real issue is that the problem with health reform is that it's focusing way too much on who is covered, the 48 million, which we need to do, but not enough on what's covered. We pay for, if we just do more bypass surgery and angioplasty and drugs and so on 48 million more people, then costs go up exponentially. That's when we have these painful choices like rationing, raising taxes, letting the deficit go up. That's threatening the viability of health reform. But what we found in our studies is that lifestyle can not only be prevention, it can be treatment. 3/4 of the $2.1 trillion in healthcare costs are really sick care costs. It goes for 4 diseases: heart disease, diabetes, prostate or breast cancer, and obesity, all of which we found not only can be prevented, but even reversed by changing lifestyle at a fraction of the cost.
I believe, Dr. Scheiner, you probably agree as well. You got to do exactly what Dr. Ornish is saying, deal with preventive medicine to make sure you don't have to do these very expensive, complicated procedures. You prevent people to try to do the best you can from getting sick in the first place. But given the current political environment in Washington, Dr. Scheiner, do you see any possibility that even if President Obama wanted a single-payer system, what Canada has or Britain has or France has, that he could politically get it through?
Well, you know, the question is that right now there are 89 representatives in the House that support the single payer. 60% of physicians support single payer. My organization, there are 16,000 physicians who are fighting for single payer. The question is, I don't think the public has adequately been informed as to what single payer is. It has been so demonized. Medicare works. Now, why is Medicare expensive? Because it takes care of old, sick people. If it was universal, the cost would be spread out. If the administrative costs were lowered, we would be able to afford it. I don't know why people are so frightened. A national health insurance doesn't mean that we have socialized medicine. We have private doctors, free choice. Patients do not have free choice today. They have to go to the doctor their insurance company says. They have to go to the hospital, the laboratory. The medication constantly changes because they tell us it's not in their formula. I want the public to have freedom of choice. Single payer gives it.
Let's talk a little bit about some of these advocacy ads that have been running, especially those suggesting that seniors are going to be especially hurt by the Obama plan, the Democrats' plan. And let David Scheiner, Dr. David Scheiner, who was President Obama's personal physician for 20 years, let him weigh in. What do you say to those seniors who are really worried that the government will undermine their health in their remaining years?
Well, you know, 80% of my patients are Medicare, and a vast majority of those are 75 and older. I think this is a myth that, again, has been promulgated by the forces that are against health reform, because they know that will scare senior citizens. Now, the idea of addressing advanced directives is an extremely good idea. I mean, I have advanced directives. I think everybody should have them. I think it makes great sense.
You're talking like a living will.
But exactly. But the public has been scared by the scaremongers who obviously don't want change. We know the medical industrial complex does not want change. There's no way around it. A lot of people will not make that same amount of money.
All right, let me let Congressman Paul weigh in. Go ahead.
No, it's Dean Ornish. I wanted to say something.
Well, let me let Congressman Paul weigh in on that specific issue. What's wrong with letting folks decide what kind of major medical treatment they might want down the road, especially at an advanced age?
Well, they say they're not going to have any control, but they're going to pick the insurance companies. And thinking about picking insurance company, if they pick the insurance companies and what they have in Oregon, when you have end-of-life discussions, you know, there they have assisted suicide. So this idea that that's a benign argument, I don't think holds water. But it isn't as radical as some people claim. But I think it opens up the door for these discussions because the government will be paying for the medicine. But I would want to make one statement about the payment of this. The cost is a big deal. Every medical program we've ever introduced into this country, we claim it'll cost a certain amount. It always costs 2 to 3 times as much. So they say this will cost $1 trillion. It'll cost $2 or $3 trillion. We already have $50 billion just to keep the records in this. I have a suggestion. Cut the spending overseas, bring some of that money home, and take care of these people until we can get back to a sensible medical system.
You know, we keep talking about health insurance reform, but we're not really talking about health care reform. We found that the more people changed, the better they got, no matter how old or how sick they were in terms of their heart disease, their prostate cancer, their diabetes, and so on. Senator Ron Wyden, a Democrat from Oregon, Senator John Cornyn, Republican from Texas, Senator Tom Harkin, Democrat from Iowa, have introduced the Take Back Your Health Act of 2009 that will pay for intensive lifestyle interventions. That can really make health care available to those who need it and have our costs go down rather than up. And then we don't have these painful choices.